First, to the latest from China, reports suggest the Bayan Nur City there has sounded an alert over a suspected case of bubonic plague. The alert comes at a time when the world is reeling under pressure already and is trying to fight the coronavirus pandemic. The first case of the bubonic plague was reported from the Chinese city of Bayan Nur in Inner Mongolia Autonomous Region. The patient is a local farmer near the city and is currently being treated in local isolation. The city's authorities have announced a level 3 warning of plague prevention and control and have asked the local residents to strictly follow control measures which are likely to be in place till the end of the year. As of now, illegal hunting, eating or carrying animals out of the area is strictly prohibited. On the 1st of July, Chinese state media had reported 2 suspected cases of bubonic plague in the Kover province of Western Mongolia. Lab results later confirmed that the 2 brothers, aged 27 and 17, had contracted the bubonic plague. They had consumed marmot meat, and health officials have now warned the people to not consume marmot meat. During the bubonic plague, the infected person, as a result of the infection, develops sudden onset of fever, body chills, headache and weakness. The disease spreads through fleas living on dead rats and other rodents such as marmots and can kill the person within 24 hours if not treated properly. There are several mentions of the plague in world history. The most deadly one was called the Black Death, which killed at least 75 million people across Europe in the year 1347. And earlier, we spoke to our correspondent Patrick Falk, who's been tracking the very latest. He sent us this report from Beijing. Take a look.
Well, you covered a lot of the details already, but certainly it shows that public health is really in the spotlight in China. But as far as we understand, the victim of the first case that's been reported on, which emerged at a hospital on Saturday, was a herdsman. We still don't know how exactly he contracted the disease. That's one of the worries, and that's part of the reason why authorities have put this alert system in place, a level 3 alert, which is the second lowest level on a 4-tier system. It basically means that people have to take precautions. They have to tell authorities if they see any possible suspected cases. They're not allowed to hunt or eat bushmeat, like marmots in particular that we're talking about, and they are to report anybody that does anything of the sort. But of course, it's raised a lot of concern. There has in fact been a second report that was tweeted out by the Global Times earlier today as well, saying that there's been another case involving a 15-year-old. We don't know exactly what the details are, but the tweet told us that the 15-year-old had apparently come into contact with a marmot that had been hunted by a dog. And again, aside from the fact that it highlights, the fact that anything to do with public health is very much in the spotlight in China, it also highlights the challenges that the country is facing in dealing with this custom of eating bushmeat in some parts of the country, which, as we know, has been linked to so many other diseases that have been in the spotlight as well of late. Well, one would imagine that they are fairly stringent. China's been very much on top of all these things, partly because of the coronavirus as well. But as you mentioned, these restrictions are going to be in place until the end of the year. And we're only talking about a couple of cases. But there have, of course, been other cases that have made this a concern as well. There were a couple of cases in Mongolia not too long ago involving a couple that had eaten the kidney from a marmot. So I suppose to an extent this is really to again make public this warning about the dangers of coming into contact with these wild meats and wild animals, if you like. There are, I should say, regularly a handful of cases that occur not just in China but also in neighboring Mongolia every year. So this isn't necessarily something to be hugely concerned about, and there's not really a suggestion that there's going to be any sort of major pandemic. In fact, not even an epidemic. And of course, there is there are antibiotics that can be used against bubonic plague, although there is no vaccine at this time.